going to talk about the knee, some of the basic anatomy again, and one of the more common injuries or issues we get with the knee and knee pain. So the knee is probably one of the more complicated, if not the most complicated joint within the body, but in essence it is a hinge joint. So you get that bending and straightening of the knee, or that flexion and extension. But there is a small amount of rotation there as well. But this basically allows you to bend and straighten your leg. Comprising of the distal head of your femur, so the femur is that main bone in your thigh, so the end of that, along with the head of the tibia. The tibia is your shin bone, and sitting just below your tibia is your fibula. Now the tibia is covered with cartilage that reduces friction between those two bones and allows them to articulate nice and freely. You also then have the meniscus that sits in between the joint, which basically acts as a shock absorber. You then have some ligaments involved within your knee. So you've got posterior and anterior cruciate ligaments, and you've got medial and lateral collateral ligaments. The main job of those ligaments is to stop your knee travelling too far forward or backwards, or too far inwards or outwards. Now, across the front of your thigh, you have the quadricep muscles, or the quads, and as the name suggests, there are 4 of them. The main job of those is to extend or to straighten your knee, straighten your leg. They attach at the top of the patella. Patella is your kneecap, so they come down the front of your thigh and attach into the top of that. Coming out the bottom of your kneecap is then the patella tendon. A common issue we see a lot of is pain of this tendon coming out of the bottom, which can be referred to as patella pain, runner's knee, jumper's knee. Usually you'll have pain right towards the bottom of the kneecap, or sometimes it will feel like it's on the inside. Now, usually as well, when you're negotiating stairs, you're going to feel a little bit more discomfort in there, and also when performing your lunges or squat type movements. You guessed it, usually down to a load issue, or more so an overload and poor load management. These muscles and these tendons are extremely strong, but that doesn't leave them any less open to becoming overloaded and overused. Again, usually through poor load management and recovery. Tendons take a longer time to heal, so if you're out there hammering yourself and not putting any time or any effort into your recovery, potentially you're going to then start exceeding that rate again. So we're going to look at a couple of exercises. Now these are just a starting point for trying to reintroduce some of those movements and starting to reload that in a nice, gentle, progressive way. For this exercise, find yourself a bench or something for support, and you're going to get into that Bulgarian split squat position. From here, you're going to drop down, bend the knee until you feel that discomfort. As soon as you feel that discomfort, just pop back up ever so slightly to take the stress off. And then all you're going to do is hold that position. Just from a different angle here from the side, you see we're going to drop down, and then we're just going to come back up just to take that discomfort away. And then all we're going to do is hold that position and then swap sides.